I've seen thousands of decayed teeth throughout my career. This tooth was so severely decayed that the entire crown was destroyed. But that was not the most surprising finding. Growing out of the center of this tooth was a mass of pink tissue that looked almost like tiny fingers. Today, we're going to discuss what this actually is, why it develops, and what can happen when tooth decay is left untreated. I'm Dr. Tom Bolten. Welcome to the Open Reduction. This patient came to my office in pain with a grossly carious tooth. This is nothing new. I deal with this all day, every day. But this interesting finding in the middle of the tooth is why I'm putting this video together. Normally, the pulp of the tooth is well protected within the enamel and the dentin. However, when a cavity becomes large enough, the pulp can become exposed to the oral environment. Remember that dental decay, or a cavity, is due to a bacterial infection. When this bacteria travels into the pulp, the body has a reactionary response. In younger patients, and occasionally adults, the body can respond to this by producing an overgrowth of granulation tissue. Instead of dying completely, the tissue tends to grow and fan out from the exposed pulp. What you're looking at now is known as a pulp polyp, or chronic hyperplastic pulpitis. The extensive decay has destroyed much of the clinical crown. In the center of the remaining tooth structure, you can see the inflamed tissue projecting outward from the pulp chamber. This tissue is highly vascular and often bleeds when manipulated. While it may look alarming, this is actually the body's natural response to chronic inflammation and infection. Unfortunately, by the time a tooth reaches this stage, it is no longer salvageable. The amount of structural damage is simply too extensive. Treatment involves extraction of the tooth and the removal of any chronic inflammatory tissue. Cases like this serve as an important reminder that dental decay is not just a hole in a tooth. Even though this looks bad, this could have been much worse for the patient if an acute abscess formed in the vestibule or in the palate. The good news is regular dental care can often prevent a problem from reaching this point. Check out my channel, The Open Reduction, for additional interesting oral surgery cases just like this one. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.